Greetings, my fellow doctors, medical students, friends, my beloved audience, and our respected Professor Dr. Zainal Arifin. My name is GOOI ZHI XIN, currently a Year 1 UMS medical student with matrix number BM2411020. It is my pleasure to present my SSM video about my passion to pursue a career in medicine, specifically as a pediatrician and the common diseases associated with the specialty. Before I continue, let me start with an introduction about pediatricians. Pediatricians are doctors who deal with the health and medical care of infants, children, and adolescents from birth up to the age of 18. But due to the increasing recognition of developmental and healthcare needs during transition to adulthood, it has led some healthcare organizations like American Academy of Pediatrics to implement extended care into the early 20s. The pediatric patients' age range for infants is from birth until age 1. As for toddlers, it ranges from age 1 to 3. The age range for children is from age 3 to 12, whereas for adolescents, it ranges from age 13 to 18. Pediatrics is filled with a variety of subspecialties such that it is actually difficult to generalize the field. You can view pediatrics from a generalist versus a specialist perspective. As a generalist, you'll be handling a wide variety of presenting pathologies that do not require subspecialized care. If you are an inpatient generalist, you will be primarily working in hospitals, caring for children admitted for acute conditions. This may include infectious diseases like pneumonia. If you practice medicine in an outpatient setting, you'll be seeing patients in the clinic primarily for regular checkup, vaccination, and less acute conditions like ear infections or strep throat. As a specialist, you focus on a single system of organ. This could be dermatology, cardiology, neurology, oncology, surgery, and endocrinology. As someone who is interested in becoming a pediatric dermatologist, the organ system that draws my attention is the integumentary system. Without further ado, let's dive into the fascinating anatomy of the skin, our body's largest organ. Just to give you a brief introduction about the skin, it is not just a covering. It plays vital roles in protection, sensation, and regulation. Well, are you ready to explore its layers? If you are, let's get started. The skin has three main layers: the epidermis, dermis, and hypodermis. Each layer has distinct structures and functions. The epidermis is the outermost layer where you can see with naked eyes. It provides a waterproof barrier that is due to the keratinized stratified squamous epithelium. In fact, the epidermis is composed primarily of keratinocytes, which produce keratin that strengthens the skin. Besides that, there are other specialized cells in the epidermis which are responsible for producing pigments and protecting the immune system. So, what are the cells that produce pigments? Well, the answer is melanocytes. These specialized cells are located in the basal layer of the epidermis. They produce melanin, pigment responsible for skin color. Melanin absorbs harmful UV radiation and protects underlying cells from DNA damage. Now, back to the immune system. Which cells are responsible for it? Well, it will be the Langerhans cells that are involved in the immune response. They are found primarily in the stratum spinosum. They act as antigen-presenting cells, detecting foreign substances like pathogens and activating the immune response. Both cell types work together to maintain skin health. Next, let's move on to the layer beneath the epidermis, which is the dermis layer. It is the middle layer that provides strength and elasticity to the skin. Dermis is vascular because it is supplied by the arteries that enters its surface that form a cutaneous plexus. It has two regions, the papillary layer, which is the upper layer of the dermis, and the reticular layer, which is the lower layer of the dermis. The papillary layer is thinner as it contains a thin arrangement of collagen fibers. It also contains elastic fibers, fibroblast cells, fat cells, blood vessels, nerve fibers, and touch receptors. The reticular layer is thicker as it contains thick collagen fibers that are arranged in parallel to the skin surface. It also contains elastic fibers, blood vessels, glands, hair follicles, lymphatic nerves, and fat cells. Now, let me explain about the hypodermis, which is the deeper subcutaneous layer and not part of the skin. It consists mainly of adipose tissue that provides insulation and protects muscles from physical trauma. The skin is one of the largest and most important organs in the body and comprises approximately 16% of human body weight. As it covers the entire body, it is essential that all pediatric dermatologists have basic understanding of the basic physiology of the skin. The skin is continuous with the membranes lining the body orifice and, in certain areas, contains accessory structures such as glands, hair, and nails. It is the interface between the body and the environment. It has a number of physiological functions that are essential to maintaining homeostasis. One of the most important roles of the skin is protection. The skin protects the body by forming a waterproof layer that guards against dehydration. On top of that, it acts as a barrier against physical injuries. Oil sebum keeps skin and hair oily and has bactericidal effects. Skin also plays a vital role in thermoregulation. Sweat glands and blood vessels help regulate body temperature through sweating and vasodilation or vasoconstriction. In addition, the skin serves as sensory functions as it contains specialized nerve endings to sense touch, pressure, pain, and temperature. There is also an excretion function in the skin. Through sweat, the skin helps remove toxins. Moreover, the skin helps in facial expression, which is a dynamic tool used by humans to transmit information to others. These can be either innate expressions and can express a wide range of emotions. Last but not least, the skin is involved in synthesizing vitamin D. Sunlight activates precursor molecules in the skin to produce calcitriol, the active form of vitamin D, which is essential for calcium absorption and bone health. Some common skin diseases that are prevalent in infants and young children include eczema, impetigo, and tinea capitis. Eczema is an inflammatory skin condition that causes itchiness, dry skin, and scaly patches. Your children are most likely to have eczema if they have food allergies. It is often found on the child's face or head as well as the arms. Impetigo is highly contagious skin infection that mainly affects infants and young children. It usually appears as reddish sores on the face, especially around the nose. Over about a week, the sores burst and develop honey-colored crust. Tinea capitis, known as scalp ringworm, is a fungal infection that affects your child's scalp and hair. Tinea capitis occurs when fungi enter your child's hair follicles. A doctor can prescribe an antibiotic ointment or cream to apply directly to the source for impetigo. Soak the area in warm water. Next, pat dry and gently remove any scabs. After that, apply antibiotic ointment or cream 2 to 3 times a day for 5 to 10 days. A doctor may also prescribe antibiotic tablets if the impetigo has spread a lot. There are many treatments for skin allergies in kids, including home remedies or prescribed treatments from a pediatric dermatology office. Most eczema treatments will consist of home remedies. One of these remedies is moisturizing the skin. Over the counter medications such as antihistamine are often used to treat eczema. Your pediatric dermatologist may also prescribe topical steroid cream to treat eczema. This cream reduces inflammation and allows the area to heal. The treatment for tinea capitis requires systemic antifungal therapy because topical antifungal agents cannot penetrate the hair shaft sufficiently to eradicate infection. So basically, these are the resources I used to refer to all the necessary information in this presentation. Now, we have come to the end of this video regarding all you need to know about pediatric dermatology. I hope everything could be understood well, and I thank you for your willingness to watch till the end. Remember, do check your skin regularly and visit your doctor if you notice any suspicious changes. Thank you.